Assalamu alaikum wa rahmatullahi wa barakatuh. Today I'm going to talk about bloodstream infection. Bloodstream infection. طبعا انتم راح تاخذون محاضرة كاملة في الجانب النظري عن bloodstream infections. هنا راح نركز عادة في الجانب العملي على أهم البكتيريا اللي ممكن تسوي bloodstream infections وطريقة عزل وتشخيص هذه البكتيريا والصعوبات التي تواجهنا في عملية التشخيص في حالة bloodstream infection. لكن أيضا راح نناقش بعض المصطلحات المهمة اللي تخص هذا الموضوع. So, bloodstream infection, it means presence and active multiplication of organism in blood. Presence, not only presence, presence and active multiplications of organism in blood. When these organisms found and multiplicate in blood, it leads to bloodstream infection. Bloodstream infection, and as we know, a bloodstream infection is one of the most devastating but preventable complication in hospitals and particularly in critical care unit. Critical care. As we mentioned above, there are some medical terms referred to bloodstream infections you must know, and the most important one regarding this term, bacteremia, septicemia, toxemia, and of course sepsis. Now, what they mean by bacteremia? Bacteremia, it means present but not necessarily replicate in blood stream. So bacteremia may be bacteria found in blood but not necessarily replicate in blood. For example, when you are flossing your teeth, flossing and brushing your teeth, flossing بالخيط يعني نسويها, and brushing your teeth, you can get or facilitate an access to introduce some normal flora found in your mouth into blood. But this types of bacteremia or this type of bacteria not necessarily replicate. It is get rid out from the blood again, so it is transient bacteremia. While septicemia, bacterial infection of a bloodstream with replicating bacteria. Septicemia, bacteria and replicate in blood. Bacteria found in blood and it is also replicate in your blood. That's septicemia. While toxemia, it means presence of toxin, usually of the bacteria, in your blood. Sometimes septicemia, it is synonym to toxemia. It is used interchangeably. The term used interchangeably sometimes. But there are some difference between septicemia and toxemia but in practical. Septicemia sometimes refer to pathology of disease, change, pathological changes followed the infections may be called septicemia, especially in bacteria. While toxemia, it means a blood poisoning, presence of toxin, but not essentially found bacteria. Sometimes bacteria destructed and release some toxin. So the presence of toxin, only toxin in blood called toxemia. So it is blood poisoning, blood blood poisoning. While in case of sepsis, the difference between sepsis and septicemia. Septicemia, it is also used interchangeably, but they are not truly interchangeably. Also, the terms are closely related. I mean, sepsis, septicemia, and sometimes toxemia, closely related to each other and sometimes used interchangeably. But in fact, sepsis is an extreme inflammatory response to infection. Sepsis is defined as an extreme inflammatory response to, infections. For more detail, as you know, serious bacterial infection at any site through the body, with or without bacteria, with or without the presence of bacteria, can usually associated with dysfunctions of body organ. So in sepsis, sometimes you can not detect the bacteria, but the change in organ occur as a result to inflammatory response, and that's found in many types of disease. This mechanism or this dysfunction of body organ mediated by immune response by cytokines, chemokines of immune system, and such multiple organ failure, such response sometimes lead to multiple organ failure, such as systemic inflammatory response syndrome, or what is called sepsis shock, as a result to cytokine storm, and this sepsis not only related to bacterial infection. Some viral infection can lead to sepsis. Some viral infection and other organ, pathogenic organ, can lead also to sepsis. So this is called sepsis result from the inflammatory response, result from cytokine storm. So this is a sepsis. Sometimes sepsis produced by an infection that is present only in one part of the body, such as in case of lung infection, pneumonia, lung infection lead to sepsis in only in lung, but lead to sepsis. So this is the difference between sepsis and septicemia. Septicemia can do to bacteria in the bloodstream. Bacteremia can be classified according to the mode of introduce of the bacteria into the body, either primary or secondary bacteremia. In primary bacteremia, bacteria have been directly introduced into the bloodstream through the skin abrasion, in surgical incision, trauma. The bacteria can get access into the blood. This is primary bacteremia. While in secondary bacteremia, bacteria get an access to introduce to the blood from other site or from other organ through the body, such as in case of pneumonic plague, the bacteria that causes plague, الطاعون, Yersinia pestis, introduced to the body through the inhalation of bacteria and go to the lung. Then from the lung can be disseminated to the body to cause septicemic plague, or in case of bubonic plague, which when the bacteria Yersinia pestis multiply in the lymph node, then from the lymph node can be disseminated to the blood and causes this septicemic plague, or sometime from the bladder, from the urinary tract, and disseminated to the blood. So this is secondary bacteremia. And sometimes bacteremia can also categorize is according to the timing of bacteria presence in bloodstream into transient bacteremia, intermittent bacteremia, or persistent bacteremia. In transient bacteremia, bacteria present a few minutes or few hours in blood, then cleared out by the immune system without causes any harmless effect in the body. This is transient. This is transient bacteremia. While in case of intermittent bacteremia, this type of bacteremia characterized by periodic seeding of the same bacteria into the bloodstream by the existing infection elsewhere in the body, such as abscess, pneumonia, or bone marrow, then clearing the bacteria from the bloodstream. So in case of intermittent bacteremia, there are existing infections, focal infection elsewhere in the body, and such as abscess, skin abscess, or other or lung abscess found in the lung, and from this focal infections, the bacteria disseminated to the body, but the immune system can clear it, and also continuous. This is a process. While in persistent bacteremia, characterized by continuous presence of bacteria in bloodstream, and the body have inability to clear it from the blood, and this in this case of, or this type of bacteremia occur in case of infection of heart valve or central line associated bloodstream infection, central line associated bloodstream infection, or in case of some chronic disease such as brucellosis, Sometimes you can heard neonatal sepsis. Neonatal sepsis. It's a type of sepsis, but it is restricted to neonate. It is two type. Early onset or late onset sepsis. Early onset neonatal sepsis or late onset neonatal sepsis. Early onset sepsis present with 24 hours. While in late onset sepsis, present above the 72 hours, called. And so when the sepsis occur directly after delivery or through delivery, this is early onset sepsis. While after 3 days after delivery, it is called late onset sepsis. Many bacteria can cause this type of sepsis, particularly group B Streptococcus, Escherichia coli, coagulase negative Staphylococcus, Haemophilus influenzae, and Listeria monocytogenes can cause early onset sepsis. while in late onset sepsis, which occur after 3 days and sometime after 1 month of life, it can causes by gram-negative bacteria, mainly gram-negative bacteria, such as E. coli, Klebsiella, Serratia, and Acinetobacter, Pseudomonas, and coagulase negative Staphylococcus and group B Streptococcus also can causes late onset sepsis. So late onset sepsis occur after 3 days of delivery, after 3 days, sometimes after 1 month. After 1 month, it is called late onset sepsis. Late onset sepsis. Now, how we can diagnosis? How we can diagnosis of bacteremia? How we can diagnosis of bacteremia? Of course, one of the most important methods for diagnosis of bacteremia is a blood culture. One of the most popular method. One of the most important method in diagnosis of blood culture is one of the most important method in diagnosis of bacteremia is blood culture. So a blood culture is laboratory test in which blood taken from the patient and inoculated into special bottles containing special culture media to determine the type of infections. Why we are use the blood culture? To confirm presence of the bacteria and to study the sensitivity or susceptibility of this pathogens to antibiotic. So it is a guide to antimicrobial therapy. Volume of blood, it is an essential steps to determine the successful blood culture. The recommended blood to broth ratio 1:5 to 1:10 1 إلى 5 1 إلى 10 النسبة المطلوبة ما بين البلد والبروث لكن اكو هسه حاليا ثم تعرفون حضراتكم commercial continuous monitoring blood culture system may be used as a smaller than blood to broth ratio أقل من 1 إلى نص. ليش؟ هاي التيوبات الخاصة اللي موجودة ممكن تستعمل بها أقل من 1 إلى نص لأن هم ضايفين للميديا فد additional substance called sodium pauline thiosulfate. وليش احنا نزيد يعني نسبة البروث عن نسبة البلد؟ لأنه أكو substance بالبلد ممكن تسوي inhibition وتسوي inactivation للculture للبكتيريا to prevent multiplication of bacteria in blood. So in this type of commercial continuously monitoring blood culture system هذا السيستم يضيفون صوديوم بولين ثايوسولفيت هذا حتى يمنع الانكتيفيشن يمنع عملية الانكتيفيشن مال البكتيريا اللي موجودة بالدم بالتالي يسهل عملية الكالتيفيشن of this bacteria. The volume is recommended to optimize pathogen recovery when the bacterial or fungal less than 1 colony forming unit per mole of blood, which is common finding. يعني انت colony وحده من pathogen or fungal وانت مستعمل فد recommended volume to broth ratio colony وحده وانت مستعمل كل الاسترايل كونديشن، ممكن هذا يعتبر finding or pathogens. هذا الفيجر figure number of blood culture set، شلون يعني هاي اللي موجودة الآن بالمختبرات. عادة ناخذ من 2 إلى 3 سامبلات، البلد نقسمه إلى 2 إلى 3 bottles، واحد نخليه aerobic وanaerobic for each septic episodes. وراح هذا بينما هذا إذا أعطاني بوزيتيف أوكي. إن كلتشر نيجاتيف، إذا الكلتشر نيجاتيف بعد 48 ساعة والمريض لحد الآن عنده الأعراض مال بكتيريميا أو سبتيك، لازم بهيج حالة نعيد من جديد ناخذ 2 إلى 3 additional set of bottles وأيضا نزرعه. إذا الكلتشر نيجاتيف بعد 24 ساعة، يعني سوينا له من جديد كلتشر وبقى نيجاتيف ممكن والأعراض موجودة، لازم البروتوكول نعيده، نتأكد إنه إحنا جامعين أو collection of sample through the fever or maybe sometime prolonged incubation period, because some bacteria needed more than 24 hours, more than 72 hours in case of Brucella, or sometime as a result this infection may be result to other pathogen other than bacteria. So recommended number of blood culture set ناخذ من 2 إلى 3، ناخذ الدم نقسم من 2 إلى 3 bottles، نخلي aerobic وانيروبيك. إذا الكلتشر نيجاتيف لازم نعيده من جديد، نرجع من جديد ناخذ 2 إلى 3 ونزرع ايروبيك وانيروبيك. إذا بقى نيجاتيف لازم نشيك البروتوكول، لأن الأعراض ما زالت موجودة عند المريض، لازم أشيك البروتوكول، أزيد عملية الانكيوبيشن، وأخلي ببالي أيضا إنه إذا ظل نيجاتيف ممكن other pathogen, other causative agent other than bacteria can cause this type of infection. Collection of blood, collection of blood from different sites, it is an important steps in diagnosis of bloodstream infection. Commonly we are used peripheral vein or artery, and there is no true advantage between artery over venous specimen. Venous specimen is convenient, and sometimes we are use intravenous catheter, and sometimes umbilical catheter can be reliable as a source for specimen, and umbilical catheter mainly can be used in infant or in neonate, but peripheral vein or artery, it is more recommended and it is more easily to obtain blood samples. In addition to peripheral blood used venous blood to collect the blood. In addition to that, sometimes we are used bone marrow aspiration as another site for collections of samples for blood cultures. In this case, when you are peripheral blood is still negative, but you are suspected your patient have bloodstream infection such as of brucellosis, bacterial endocarditis, and in some cases of febrile infections, and the peripheral blood still give negative culture, you can use alternative site for blood culture. In this case, you are used bone marrow aspiration, but only we are tend to use bone marrow aspiration if you are considers the infection are suspected and the routine culture is still negative. And in some cases, you are going to collected the blood from the central line or central venous line, which included central venous line included jugular vein, subclavian, axillary vein, and groin femoral vein. This type of vein called central vein. Specimen. In case of neonatal infection, and we are recommended to use umbilical catheter or heel stick, skin stick, heel stick can be used when you can take a small amount from the blood by using heel stick. But blood culture should not be taken from the following site: from IV cannula. It is not recommended to take blood samples from femoral vein, because this femoral vein, it is not recommended because this area high risk for contamination. Femoral vein, this area high risk for contamination, and if you necessary to take the blood from femoral vein, you must use skin disinfection, appropriate skin disinfection before or take blood from this site. Timing of blood culture, it is necessary. Time of take blood through the febrile episodes, it is necessary. During chills, it is when you take blood when you take blood from the patient during chills, it is increased probability to recover pathogens from blood. In case of timing of blood, you must collect it as soon as possible after the onset of fever or chills, whenever serious infection is suspected, whenever possible through the chills or fever, you can take blood. And one of the most important criteria, or one of the most important point you must put in your mind when you are taking blood, you must take blood prior to the administration of antimicrobial agent, before starting or initiating the antibiotic. This is an important and point in case of blood culture. Whatever fungal pathogens or bacterial pathogens, you must take blood before starting or initiating in the antimicrobial therapy. Sometimes you must repeat culture, as we mentioned in first figure. You must repeat culture to document and clearance of pathogens after you are culture the blood and then the blood and give a positive result. After that, you are after a demonstration of antibiotic, you must also repeat it, the blood culture to ensure recovery of the patient from the bloodstream infection. Other important point in case of blood culture, it's the transport the blood from the bedside to the lab. Prior to transport, vials should be properly identified. لازم تخلي الفيالز او الباتلز لازم يكون معرف عليه اسم المريض، رقمه، الطابق، متأخرة. Transport time should be as fast as possible. The transport temperature should not be extreme. Preferable the transport of bottle at room temperature, never frozen, never refrigerated, not higher than normal body temperature. You must ensure that there is no vial leakage at the time of transport. ماكو فد تسريب، ماكو فد فتحة بالفيال. So adequate transport container you are used when you transport the vials, and also other personal protective equipment must be used to in case of bloody transport. This is an important point. So this is an important point when you are get or initiate the blood culture type of ratio of blood to broth. It is important. And site of infections, site of blood taken, whatever peripheral or arterial, and also time of episodes, time of blood collecting, it is necessary, and transport method from the bedside to the laboratory. It is also important to can get successful blood culture result. Now, how we can interpretation of the blood culture? A true infection is almost always present in the culture. If the culture is positive, that's mean a true infections. A true infection in case of pathogenic bacteria such as Streptococcus pyogenes, aerobic and facultative gram-negative roots, anaerobic gram-positive cocci, anaerobic gram-negative roots, and yeast. So when you are get or cultivated Streptococcus such as Streptococcus pyogenes, aerobic and anaerobic gram-negative or gram-positive roots, all gram-negative roots, it's mean pathogenic. All gram-negative roots, it's mean pathogenic. Candida or other type of yeast, when it is cultivated from blood culture, it means a true infection. But negative growth does not rule out infection. Contamination, one of the most obstacle and obstacle in blood culture As we know, blood is an enrichment medium. So it is facilitates growth of different bacterial pathogens in exposed to contamination. In blood culture, it is suspected. Now, how we can suspect contamination? If only one of several culture is positive. Repeat culture, 3 times of culture, but only one of several culture positive for non-pathogenic bacteria, such as coagulase, non-coagulase staphylococcus species. If you are detected bacterial growth after 5 days, 5 days بعد 5 أيام جيت لقيت الكلتشر مطلو بوزيتيف ومطلو بوزيتيف لل non-pathogenic bacteria such as Staphylococcus epidermidis, Streptococcus viridans, or Bacillus species, Coenbacterium species other than Coenbacterium diphtheria, such as Coenbacterium diphtheroid. So non-pathogenic bacteria, when you are get non-pathogenic bacteria after 5 days of cultivation, it is suspect. You must suspected contamination. You must suspected contamination. And sometimes when you are repeat the culturing several times and only one pathogens only one pathogens cultivated, and this pathogens it is normal flora, normal or non-pathogenic bacterial pathogens, and only you are get in one culture, that you must suspected contamination. Now, how we can reporting of blood culture, when you are get positive blood culture, you must immediately report to the physicians. The gram morphology and the number of positive blood culture must be mentioned. Negative blood culture after 24, 48, and 72 hours. So you must not recall blood culture negative unless you are checking after 1 day, 2 days, and 3 days. After 3 days, you can and finally report that blood culture positive. Not only after 24 hours you are report blood culture negative. This is some pathogens, bacteria that causes bloodstream infection, gram negative, gram positive, candida, staph, streptococcus pneumonia, and other. Any pathogen any bacterial pathogens have ability to overcome the immune system and multiply inside the blood and causes signs and symptoms. So it is pathogenic. And causes bloodstream infection. But some false positive blood culture, this figure shows some positive blood culture trash. Staph aureus 2 infections ب 87%. هاي إحصائيات عالمية. بينما الكواجليز نيجاتيف ستاف تكون 2 ب 12%. 82% هي false positive trash and other bacteria you can see. Now, how we can interpretation of blood culture: organism isolated, and after more than 3 days, it is often contaminant. After 3 days, it is often contaminant, and particularly when this organism opportunistic bacteria, non-pathogenic bacteria, non-pathogenic bacteria. single blood culture with coagulase negative Staphylococcus species is often contaminant. لازم بحالة إنه من يطلع عندك coagulase negative Staphylococcus species مثل Staphylococcus epidermidis, Staphylococcus subophyticus عزلتها من الدم، ما تعتمد عليه، تعيده وطلع مرة ثانية نفسها تعيده 3 مرات. إذا طلعت نفس البكتيريا ستاف ابيديرمتس يلا تعتبره ترو انفكشن، لكنه إذا مرة واحدة والباقيات نيجاتيف هذا يعتبره contaminant. While single positive blood culture with Staph aureus or any gram-negative bacteria or candida, it is always and it is often a true infection. Sometimes you can get non-pathogenic bacteria, but the report of the blood film show a patient have not leukocytosis. That's or shift to lift. That's mean you can suspected this is a contaminant and not a true infection. So the true so the bacteria that causes contaminant or considered contaminant gram coagulase negative Staphylococcus when only cultivated in single blood culture, coine bacteria diphtheroid, not diphtheria, bacillus species. If multiple isolated from separated sites are obtained, the organism could be pathogenic. If multiple isolate from separated sites are obtained, the organism could be pathogenic. شنو يعني؟ يعني أنت أخذت من أكثر من مكان blood، أخذت من الفيمورال، أخذت من الجاجولار، أخذت من peripheral blood culture هذا وطلعت نفس الأورجانيزم طلع coagulase negative، طلع ستريبتوكوكس مثلا ستريبتوكوكس فيريدنس، أو طلع عندك coagulase negative ستافيلوكوكس من أكثر من مكان أخذت، هذا تعتبره باثوجين not contaminant. This is a pathogenic not contaminant. So why blood culture? Why we need the blood culture? Confirm presence of microorganisms in blood stream, identify microbial etiology, provide guideline to susceptibility test. Blood culture should be made for cases with septicemia, endocarditis, secondary or primary bacteremia, pyelonephritis, epiglottitis, meningitis. You must recommend it to use blood culture. This figure shows aerobic and blood culture media used to cultivate pathogens from bloodstream infections should have some important point to consider as a successful or appropriate media used in this field. From that, this culture media must be sensitive enough to recover a wide range from microorganisms, even most fastidious bacteria such as Neisseria and Haemophilus. And also this culture media should have ability to recover aerophilic bacteria. That means bacteria require a small amount of oxygen, or also bacteria that releasing a small amount of CO2. So the culture media should sensitive enough to recover all these microorganisms. In addition to that, this bacteria should be versatile. That's mean يعني متعددة الجوانب. Versatile can be cultivated all types of microorganisms, and also can be provide a result for all types of sample collected from adult, from infant patients, or from any types of sterile body fluid, such as bone marrow and sometimes CSF samples, not only for blood. So it must be versatile media متعددة الجوانب. But as a laboratory individual, you must sometimes reject the blood coming from the bedside. بعض الأحيان أنت بالمختبر عندك صلاحية إنه ترفض الدم اللي جايبين لك إياه من الطوابق. شو وقت؟ أكو criteria of specimen rejection. شنو هاي الكرايتيريا؟ إنه blood collected in a tube or bottle other than aerobic or anaerobic blood culture. So unsuitable bottles or a tube used for a blood culture. If the information of the label does not matching with the request form. المعلومات اللي بالريكوست تختلف عن المعلومات الموجودة بالبطل. A specimen for anaerobic blood culture received in aerobic bottles and vice versa. والعكس بالعكس، فهي ممكن أيضا ترفض. طبعا البيشنت بريبيرنج مهم جدا. عملية تحضير المريض مهمة جدا بالبلاد كلتشر. The major difficulty in interpretation of blood culture is potential contaminated by skin microbiota. So careful attention to the details of skin preparation and antisepsis prior to collection of the specimen is very important. Our blood is injected to now how we can method for collection, or after collecting the blood must be injected to both aerobic and anaerobic bottles and incubated about up to 10 days. Discard as negative after the 10 days in case of fastidious bacteria such as بروسيلا. لازم إذا تتوقع بروسيلا بعد 10 أيام يلا تقول negative. طبعا during the incubation period a gram stain and subculture into appropriate media should be done. هذا الفيجر يبين طريقة توزيع الدم. تخليه ايروبيك وانيروبيك، تسوي له جرام ستين بعد فترة وتزرع على البلد والشوكليت والماكونكي. هاي عندنا السالمونيلا سبيشيز. هاي صورة تمثل سالمونيلا سبيشيز isolated from blood isolated from bloodstream infection على الاكس ال دي وعلى الاس اس اجر produce black precipitate. gram negative bacilli anaerobic and fungi should be considered pathogen until proven otherwise. إذا حصلت gram negative roots بالculture أو anaerobic bacteria and yeast must be considered pathogens إلا إذا أثبتت غير ذلك. The most difficult interpretation problem is to determine whether an organism that is usually considered normal skin microbiota is a true pathogen. واحدة من المشاكل اللي تواجهك انه انت normal skin microbiota طلعت بالبلد، هي هنا المشكلة اللي تواجهك، فلازم تعيد الكلتشر أكثر من مرة، يفضل from other site إذا طلعت نفس البكتيريا لا تعتبرها pathogens. How many days of incubation are recommended؟ بعض الأحيان عدد الأيام الحضن هم مشكلة، يعني أنت عادة 3 أيام كلش أوكي، لكنه إذا تتوقع المريض عنده بروسيلا هذا لا، راح تخليه لازم أقل شيء 10 أيام، أقل شيء 10 أيام، يلا تقدر تقول عليه نيجاتيف. فالريكوست اللي تجيك من الدكتور مهمة جدا، تبين لك انه شنو suspected disease in your patient. We have two criteria. We have two criteria to consider the blood culture positive. That's mean true infection. That's mean the blood culture reflected as a true infection. We have two criteria. Criteria 1, when you are isolated recognized pathogens. Recognized pathogens, that mean true pathogens. Isolation of one or more true pathogens or recognized bacterial or fungal pathogens from one or more blood cultures. Or in case of you are suspected potential contaminant, but the patients have one of the following signs and symptoms of bacteremia or septicemia within 24 hours of positive blood culture. Patient have fever, chills, rigors or hypotensions, or in case of patients, infant patients, signs and symptoms include fever, hypothermia, apnea or bradycardia, apnea or bradycardia. You must consider this blood culture as a true infections when you are isolated a potential contaminant bacteria from more than one samples. In addition to that, patients have signs and symptoms of bloodstream infection such as high fever, chills, rigors, hypothermia and bradycardia. In this case, you are consider the blood culture reflected to true infections. And thank you.